So it is no secret now that the number of coronavirus testing conducted in Japan is very low, actually very scandalously low. So there are some views that the coronavirus outbreak situation in Japan is actually much worse than what is reported in the media and so on. However, having said that, it is true that the number of coronavirus testing is very insufficient, and there may be really many patients lurking in society. However, it appears that the number of severely affected patients and the number of deaths from coronavirus seems to be relatively low compared to other countries like the United States and European countries. So why is it? It's a great coronavirus COVID-19 enigma in Japan. And there are some theories that maybe the number of patients who are dying from the coronavirus disease is underestimated, because even if patients have pneumonia and die from it, if they are senior citizens, the medical doctors do not test for coronavirus specifically, and the death will be counted as normal pneumonia cases, not as coronavirus cases. So there are some people who say that the number of deaths from coronavirus actually is much higher than those figures officially reported by the Japanese government. So there are many uncertainties at many levels surrounding the coronavirus outbreak in Japan now. First, as I said, the number of confirmed cases of infection is probably much lower than what is actually happening here, because, as I said, the number of testing is scandalously low. However, the number of severely affected patients and the number of coronavirus-related deaths appear to be low. These figures cannot be really concealed under the table, because if there are some medical situations that where the medical facilities are packed to the full, and the medical doctors are pressured to treat many severely affected patients, that would be reported by the Japanese media, even though they tend to be relying on the government published figures. So there's a real enigma here. Why in Japan the number of severely affected patients from coronavirus appear to be low, and why in Japan the number of coronavirus induced deaths appear to be low. These are real puzzles, and some people say that maybe the situations would get much worse in a few weeks, when the undetected patients, some of them develop severe symptoms, and some of them actually might unfortunately die from the disease. So when that happens, some people say that situation in Japan would be as bad as those in other countries. So nobody knows. So this is a great coronavirus COVID-19 enigma in Japan, and nobody knows, including experts, and not to mention the government officials knows the true situation here.